So I'll briefly introduce Dr. Khan's CV. He's an experienced fertility specialist with a growing reputation throughout Australasia due to his understanding and care for patients of different nationalities. He graduated from the University of Sydney with honors and worked for 3 years also in London in Guy's St. Thomas and Lister hospitals before returning to Sydney to set up the IVF Australia clinic. Dr. Khan worked in Australia for 30 years before moving back to Singapore to work in the Virtus Fertility Center. He has spoken throughout Asia about various topics, including his main interest in examining the differences between Asian and Caucasian patients and the low-cost IVF. So welcome, Dr. Khan. Thank you for joining us.
Welcome. Thank you very much. Thank you, Vivian, for your kind introduction. I think the majority of the audience are from Japan. So konnichiwa, Khan Andrew to moshimasu. 日本語はもう20年勉強しました。でもまだまだです。これから英語で話し続けます。よろしくお願いします。ありがとう。So I'll just start by saying that my talk today involves both Australia and Singapore. So 2 different countries, and I got to do it in 30 minutes. So I don't have much time. But hearing Professor Thornhill and the system in United Kingdom and how it's all diversified, I think maybe I have more time than him. But these are the 2 countries I'm going to talk about. I'm going to talk about them simultaneously so that we can compare. And let's see if I can change screens. And I'm going to talk about, when I talk about the money side of things, I'm going to be using the Australian dollar. The fortunate thing is that the Australian dollar is almost equal to the Singapore dollar, 1-to-1. And to Japan, you just need to move the decimal point two steps to the right. So, 1 Australian dollar or 1 Singapore dollar equals about 100 yens. And the rest of you will have to do your own exchange rates as of 2 days ago. Right. So we're talking about these 2 systems. And in Australia and in Singapore, there are lots of things that are similar. So with regards to the government, the national health insurance for these 2 countries, there is basically 3 tiers. So there's the first tier, which is a general system for its public. When I talk about public, I mean both in Australia and Singapore, they are citizens and they are permanent residents. And this is called Medicare in Australia, and it's called MediSafe in Singapore. If you want something further, if you want something more, like for example, in Singapore, if you don't want to be in a hospital ward where there's 4 beds, you want your own private bed. In Australia, if you want, after being covered by Medicare, there's still a large gap. You can buy more insurance. So the next tier is basically a private health insurance. In Australia, it's just private health insurance, but there is a name in Singapore. It's called MediShield Life. And finally, there is this general safety net. So the safety net is covering people with very, very large bills. So for maybe oncology, for even in IVF, where if after you claim from Medicare, there's a big gap, and you claim some from health insurance, there's still a big gap, Australia will rebate you more. So that is the what they call the extended safety net. In Singapore, we have the same thing. This is for catastrophic diseases, which is not covered by MediSafe or MediShield, or you've used up MediSafe and MediShield, then there is another level of care, the safety net, which they call MediFund. This does not cover infertility in Singapore. So let's briefly talk about each of these systems, and then we will talk about how these systems cover infertility in these 2 countries. So in Australia, the basic system is called Medicare. In both Australia and Singapore, the current system, Medicare in Australia, MediSafe in Singapore, evolved around the same time, 1984. Okay, so Australia is quite simple. It's basically provides general care health coverage for all its citizens and permanent residents. The main difference between Medicare and MediSave is that in Australia, everyone that is paying tax contributes to it. So let's say your annual income is $100,000, then you'll be paying 2% of your taxable income to this pooled system, the Medicare, and anyone with a Medicare card, which is Australians and permanent residents, have access to it. So even if you're not earning any money, you have access to this Medicare rebate system. And Medicare will rebate you according to there are Medicare benefit schedules, and each item, whether it be an operation or treatment schedule, must have an item number before it attracts a rebate from Medicare. In Singapore, the main difference is the way you actually get your money for this. MediSave in Singapore is your own money. You have your own private MediSave account, which you contribute to it yourself. So every month, you will contribute 10.5% of your own money into this into your own private MediSave account. And the government stipulates that you cannot take any of this money out except to pay for hospital bills for yourself and for immediate family members. We'll talk about this later, but in 2004, the Singapore government allowed you to withdraw from your MediSave account for infertility treatment. So the next level of care is private health insurance. So in Australia, most things are covered by Medicare. But after you claim from Medicare, there might be still, if let's say you go to private healthcare, there might be still a gap, a large gap. And then if you don't have any private health insurance, you will have to pay that out of your own pocket. So you can actually buy private health insurance. It's quite simple. You just go down and you just look at whichever company is offering private health insurance. So Bupa, Medicare, Medibank Private, HCF. These are some of the companies that offer private health insurance, and they will help you pay not usually all, but a big portion of the gap. So this private health insurance in Australia is not mandatory, it's optional. But the government is trying very hard to get its citizens and permanent residents to buy private health insurance to alleviate the burden of Medicare. So if you are paying your 2% Medicare levy out of your taxes and you do not buy private health insurance, the government will put a Medicare levy surcharge on top of the Medicare levy that you pay. So if, again, going back to the example, if you earn $100,000 a year, you will have to pay $2,000 to the Medicare levy, and that is for Medicare. But if you do not take out private health insurance, you have to pay an extra, and it varies, but it could be up to 1.5%. So, you've got to pay another $1,500 on top of that for the Medicare levy surcharge. And private health insurance varies. The premium for private health insurance varies from $1,000 to about $2,000, depending on the level of care. So you can see that, you might as well take out private health insurance or else you'll be just paying that in tax. In Singapore, it's a totally different system. So we're talking about that second level of care. It is actually run by the government, and they will force you. So every citizen and permanent resident has to take out this MediShield Life, which is a sort of an insurance plan. And the premium does vary. It can be as cheap as $145 a year for up to 20 years old. And if you're fortunate to live past 86 years old, then you have to pay up to more than $2,000 a year. You can take money out from your own MediSave account to pay for this premium. It does not apply to, you cannot use this money for infertility treatment. You can only use, again, for very costly treatment that you don't want to use your own MediSave account, or you have already finished up your MediSave account money, so you can use MediShield Life. And lastly, the extended, the safety net system. In Australia, the safety net is also, does also apply to infertility treatment. So if you use the Medicare for infertility treatment and there is a gap, you can use private health insurance. And even after that, if you have reached a certain threshold for that calendar year, you can also use this Medicare safety net to get more rebate. Singapore system is different. It does not apply to infertility. It is basically an endowment fund, which the government tips into this fund, and the interest from the fund is debited up to the different hospitals, and the hospitals use it at their discretion for, again, very expensive chemotherapy treatments and other forms where patients have already used up their MediSave and their MediShield Life. Right, so going back to the topic at hand, how does it apply these national health insurance schemes? How does it apply to IVF or infertility treatment? So all three systems, whether it be the Medicare, the private health insurance, and the extended safety net, can be used for infertility treatment in Australia. And in addition, something that we haven't talked about is the pharmaceutical benefit schemes. And I'll talk about that later, but that pays for the IVF drugs that are used. In Singapore, only the first basic care, which is the MediSave, covers infertility. The second level, MediSave, MediLife Shield, and the MediFund does not pay for it. But in addition to that, there is another system which the government has used to fund infertility treatment. And we'll talk about each of this in more detail. So Medicare system in Australia, if you are diagnosed as medically infertile, and that word has got a very, very clear definition. If you're diagnosed as medically infertile, then Medicare will cover any treatment, okay? I mean, any treatment, meaning the treatment we talk below, you know, IVF, IUI, frozen embryo transfer, ICSI, okay? So these rebates are not means tested, and you can use it as many times as you want, and there's no limit to the amount that you can claim. However, the Medicare system, like I said, has got item numbers. So it will dictate that for, let's say, IVF, it will recommend a certain amount to be charged, and that it will pay you 85% of that amount. So you can charge, and the private companies or hospitals can charge whatever they like, but the Medicare system will only pay that amount. If you are not medically infertile, so we're talking about same-sex couples, we're talking about single women, then Medicare does not fund that, does not fund you, and you have to pay out of pocket. So some of the, we talk about item numbers. So the Medicare will pay for anything that's on the Medicare benefit schedule, and each of the treatment, let's say hysteroscopy, hysterectomy, all of these will have item numbers. Anything with item numbers will attract a benefit or rebate from the government through the Medicare system. And these are some of the item numbers that are used in IVF. And these item numbers have increased in numbers over the years, and the amount of rebate has also increased. For example, if we use the most commonly and the most rebated item number, which is 13200 initial IVF. So if you go through the website and you can look at item number 13200, you can look at the scheduled fee, which is what they would recommend that be charged for a person that's undergoing IVF initially, first cycle, that's 3,200, and it will rebate up to 85%, which is this highlight figure. So 3,200, you can charge whatever you like. This is what you will get from the government for initial item number 13200. From time to time, more item numbers are added to it. For example, on 1st of November last year, PGT for PGT-M and PGT-SR has been added to the Medicare benefit schedule. But at this point in time, PGT-A is still not part of it. Again, from time to time, and this is very recent, you know, as of 1st of October this year, it was announced in May this year. From time to time, this is New South Wales, will offer some extra money, extra rebate to women undergoing IVF. And this is the same for Singapore, as we will see later. So this is the Medicare that will rebate you if you're going through IVF, but you can get more money back through your private health insurance. So private health insurance basically pay for hospital admissions. So hospital, where you do your egg collection, where you do embryo transfer, that part where they pay the hospital is rebated almost fully, but not entirely, by private health insurance. So if you buy private health insurance, you can use that. Usually there's a waiting list, waiting period of 1 year, after which you can use that for your hospital day surgery cases. And that is valid for infertility IVF. And finally, we talk about the pharmaceutical benefit scheme. This is sort of separate from Medicare because it's by the Australian government, and it benefits for all Australians for all types of medication that they have listed on this pharmaceutical benefit scheme. And fortunately, IVF drugs, we're talking about the 5 major types of drugs, you know, whether it be gonadotropin, antagonists, agonists, triggers, progesterones, these are on that list. And if it's on that list, it is heavily subsidized, almost to the point that you don't have to pay anything except for the script bill, which is about $2.50 for each type of medication. And there is no limit in terms of the number of times you can use it per year. Okay, going back to Singapore. Okay, so Singapore, the system MediSave started, this is your general rebate system, started in 1988. In 2004, the Singapore government decided that you can use your own money, basically withdraw your own MediSave from your own MediSave account for infertility treatment, for IVF treatment. It is, however, only available, is capped at $15,000, and you can only withdraw $6,000 for your first cycle, $5,000 for your second cycle, and $4,000 for all subsequent cycles, up to a maximum of $15,000, and then you cannot withdraw anymore. So they allow you to withdraw your own money up to $15,000. They soon realized that that wasn't quite enough. You know, usually you're not pregnant first cycle, and the cost of IVF can be a lot more than, you know, your $6,000 for your first cycle. So in 2008, they introduced this co-funding. Co-funding is outside all the insurance scheme. So it is saying that if you are willing to have your infertility treatment in the 3 public hospitals in Singapore, so in National University Hospital Singapore, in Singapore General Hospital, in KK Hospital, these are the 3 public hospitals, then they will help you. So they will co-fund you for this treatment. There are a lot of requirements, mainly that you know, you must be a Singapore, at least one of you must be a Singapore citizen. In fact, the level of rebate depends on whether both of you, husband and wife. So in Singapore, you need a legal marriage, heterosexual marriage certificate before you can even consider doing IVF in Singapore. So husband and wife, if both of you are Singapore citizen, that will attract the maximum rebate. If one of you is Singapore citizen and the other is permanent resident, you can still get some co-funding, but that level is less. You have to be, at least when you start the cycle, less than, equal or less than 40 years of age. So if you did your first cycle, and can be an IUI, and then you didn't get pregnant and you then did your second cycle at 41, that's fine. But if you've never done any cycle at all and you start and then you're 41, 42, then you do not get any co-funding. So this is the highlight figure. So the maximum, if both of you were Singapore citizens, then you get up to $7,700 co-funding. for your IVF treatment in the 3 public hospitals. Again, like in Australia, from time to time, the actual amount increases due to inflation. Things are added on. So in the co-funding, as of 1st of July, just passed, they have added PGTM and PGTSR if you do it, but you can only do PGTM and PGTSR in National University Hospital anyway. So if you, but they are now co-funding it up to 75%, especially if both of you are Singapore citizens. So this is my last slide, second last slide, and this is basically my summary. So looking at the overall picture in Australia and in Singapore, okay, I think that roughly this is what is going to happen. Remember, this is Australian / Singapore dollars. So if we look at, general cost of IVF in Australia and Singapore, I think it's roughly about the same, $11,000 to $12,000, and it can go up to $20,000. But on the high side of things, Singapore is more expensive, both in terms of drugs costs, doctors costs, collection costs, more on this side or more on Singapore side. So if you were a foreigner, okay, and you had to access IVF treatment, even if you went to the public hospital in Australia or the public hospital in Singapore, it will still be around roughly the same cost. Okay, so at the other end of the scale, okay, the least expensive, especially if you were, both Singapore citizens or, also Singapore Australian citizens or permanent residents, and you're trying to save as much money as possible, not use your own money at all, then roughly in Singapore, okay, you basically don't pay anything, because if you go to the public hospital, the 3 public hospitals, and you've used your this is not MediShield Life, this is a mistake, this is MediSave. If you use your MediSave, your own money, and you had co-funding, so we're talking about maybe 7,000 plus 6,000, up to 11, 12,000, you basically don't pay anything at all if you did it in Singapore. But in Australia, even if you went to the public hospital and you're a permanent resident or citizen, you pay about $1,500. However, because of the safety net in Australia, if you have done one cycle and you pass the threshold for the safety net, your subsequent cycles are close to nothing at all, like Singapore. But for the average, if you were looking for maybe not going to the public hospital because of the long waiting, and you wanted to access, your own doctor, or you wanted certain medication or certain protocols that are not provided by the public hospitals, then if you went the private route, then you can get money from Medicare and your private health insurance. And in Australia, you're still out of pocket about $4,000. Whereas on the Singapore side, you can only access your MediSave, and it'll still be quite expensive after that, up to $10,000. So thank you very much for your attention. I'm happy to take on any questions.
Thank you, Dr. Khan.